Welcome to my podcast. Today I'm going to talk about another common case. It's one of the acute cases, can be seen in the hospital setting. So basically, you will introduce yourself, as we always agree, double check the patient name and date of birth. The patient will be escorted to the emergency A&E, maybe by their family, maybe by the spouse, and the patient may be confused, maybe unwell, and maybe in difficulty of breathing, severe breathlessness, maybe noticed by the family that he's not in his normal state of mind. Mood swing, mental state is deteriorating. Maybe the patient did not wee for the last 24 hours, maybe vomiting, maybe feverish, maybe shivering, maybe has mottled skin, slurred speech, all of that things, maybe being told by the escorted relative, and you have to find out what's going on. So you will try to ask and speak to the patient, introduce yourself, try to see if the patient is oriented, if he's responding to you. So basically you have to check his score. And then moving forward, you will, of course, you'll judge by the age. If the patient is elderly, always you'll need to think about common cause of infection, say for instance UTI, pneumonia. So you will ask quickly the relative if they know. Firstly, you need to know what's their relationship with the patient. How has the patient been lately? If they notice anything that all of a sudden has changed, if the patient has any past medical history, if he's taken a medication, if there is any known allergy, what he was doing before he get sick or been deteriorated all of a sudden. And then while you're doing so, you will arrange for a quick blood investigation. Say, for instance, you will take blood for culture, full blood count, just to have an idea what's going on, if there's any derangement. You will also take urine for routine and dip test. And you will also take blood for lactate, just to see the pH of the patient, and from there you will assess. Of course, you're going to put the patient on oxygen, and you need to rule out if the patient has COPD, because in that condition you will give different mask. And you will, as I say, if the patient is feverish, you will arrange for immediate admission and start antibiotic within 1 hour time. And of course, you will give fluid IV and check the patient observation, blood pressure, temperature, pulse rate, and respiratory rate. And you will notice if the patient has any pain or shivering or skin rash or mottling. All of that you need to check. And you will ask if the patient has any recent operation, for instance, or if he's taking any immunosuppressant, for instance, or had chemotherapy or organ transplant. All of that you need to inquire, maybe because in the past medical history or in the medical history has something that relevant that you need to find out. Adopt, of course, the hygiene clean. So basically, you will wash hands before doing any examination, and instruct the relative and the patient as well, if he's oriented or slightly oriented, to adopt the clean approach. So basically, washing hands regularly with soap and water. And you will, as I say, arrange for the blood investigation to exclude if there is any sign or symptom of sepsis, because if it's not treated immediately, it might proceed to septic shock, which is a fatal situation. detrimental, which can lead to multiple organ failure. And of course, once you started all the investigation and treatment, recovery usually takes time, and usually the patient will feel tired, weak for some time. They might not be able to eat immediately, so they might have low appetite and might not have good sleep as well. So you just tell them that you need to keep try to eat little and often in small amount, and always wash hands before doing so, and try to get regular sleep. And of course, always you need to tell the patient about the red flag sign and symptom. So if there is anything doesn't seem right, if the temperature is not going down, of course this is meanwhile admitted, or if they've been discharged after the admission, or if it's seen in the GP and then maybe it was not arranged for admission, or maybe the symptom wasn't very clear for the GP to send immediately to the hospital. Always a red flag. And even the hospital, if the patient is not feeling well, or is not deteriorating, or not feeling themselves, or is not oriented, or their mood has changed dramatically. So always alert the nurse, or if you are sent home, always come back to the A&E immediately to be seen and assess the situation again. So by that, I should have covered the main points. If you have faced a case, usually this station will be acute. So it's one of the acute cases, because in the exam, I remember there's only one acute case and 6 telephone, and the rest they are station differs between different things. And I see you in another podcast. Thank you.